good afternoon, and welcome to Have a Chat. I'm so happy to be your host this afternoon. Another wonderful day in Miramichi, New Brunswick. I am joined by Audrey Lynch and Veronique Arseneault, two of my very favorite people. Welcome to the show, ladies.
Hi, girlfriend.
Are you enjoying? Hello. I miss you too.
Miss you too, Judy. Vero.
Hi, Vero.
Hi.
Vero has a quote to bring us this afternoon, so we're looking forward to hearing that, Veronique.
Yeah, well, it's, I was inspired by the guests that we're going to have a little bit later on the show, and of course by our family members and people that we hold near and dear. And it's actually related to medicine in this particular case. And so it's a quote by Hippocrates, and it says, "Wherever the art of medicine is loved, there is also a love of humanity."
That is so perfectly true.
Yeah.
I think,
Very
you
true.
have to have a love for medicine. I just couldn't do it myself. So, but I love humans. And yet to practice on the human anatomy or the human mind as a psychiatrist or whatever your field is, you have to have a love for people and helping, whether it's physical, mental, emotional. So I really love that quote. Thank you, Veronique.
Yeah,
it's wonderful, Veronique.
Well, and it's, I've often heard, Grandpa used to talk about, what it meant to him to be a doctor. I've heard Gerard say it so often, is that, he's there sometimes at the worst moments of people's lives, but he's able to, to put all of those things that he's learned and experienced to best possible use to try and help those people and to, to have a more fulfilled life and a wonderful life going forward. So it's really, I do think that it takes a special kind of person to be a doctor, and dedication that they have to be a doctor shows their love of humanity, I think.
Can I tell you something real special? It takes a special woman to be married to one too.
I don't disagree there.
Sometimes that crap that I put up with, like the phone ringing at all hours of the night, and I have a lovely dinner waiting. I've been working on it for the last 3 hours. Well, I'm sorry, honey, I've got to go to the hospital now. Really?
Yeah. Oh,
but
I can only imagine.
I'm just saying that because you have to get used to being left hanging a lot of the time. And I'm a very busy person, so that does not bother me. I have my own agenda. But if I was one of these wait around type of wives, it would be horrible because they are committed to patients, and that lifestyle is so hectic.
You were in on it on the ground floor, so.
Yeah. But anyway, switching gears, it's beautiful weather we've been having. I mean, this past weekend, and again, the sun's shining. It's gorgeous. We've been very fortunate to break into some good weather in May. Are you enjoying it?
Yes, a lot of people are actually getting out and about. We haven't seen too many people on the streets and things like that, with COVID being, the biggest issue the last 2 or 3 months here in New Brunswick and across the world. But now it's nice to actually see people out and about. They're doing their social distancing and getting to enjoy some fresh air and, stress relief.
Exactly. Veronique, are you finding some good stress relief in this sunshine?
Yeah, you know what? The last couple of weeks, I will admit that the first, I'll call the first phase of COVID isolation for me was a little tough. In that I spent a lot of time inside the house, but I am now in my own second phase of COVID isolation. Enjoy getting out. I'm to go for a walk at lunch now because I am working from home, which is great. But I get the dogs out first thing in the morning for a walk, and I am trying to go for a walk at lunch to take advantage of the wonderful weather, but also to change my mind and not be staring at the computer screen now for 16 hours a day and enjoy some of the great outdoors that we have around us.
Yeah, we're certainly all trying to do our best with that and getting out, barbecuing. Even a good food is important at this time. Just to have good social gatherings over food, to me, is one of the highlights of the day. Great conversation, whether it be just on your deck or whatever, with the sun coming in. So we're moving forward slowly and cautiously, but we are doing well. There have been some gains made. I see that Premier Higgs is, making changes and opening things up, which is awesome with the proper social distancing in place and caution. But Audrey, let's talk about your move to your salon. You're the owner of Sheer Heights Studio, for those who don't know, and have your own business. So how are things going for you?
Well, we are, looks like Premier Higgs is about to announce us moving into the yellow phase, which would be stage 3, which does allow gyms and salons to open. I think the biggest thing I want our viewers to know and our clients to know is that when it comes to salons, we're still a little bit different. We also are not just governed by the government and the health, the Board of Health, but also we have our own association, the Cosmetology Association, that we are governed by as well. So even though we may get the go-ahead to, yes, you may open up your salon, we also have to look to the Cosmetology Association, who sets our regulations and guidelines for safety. And even though, yes, we can open, unless we have everything that they stipulate that your salon must have in order to provide these services safely for your employees as well as your clients, you do not open your doors. So with that being said, a lot of salons have been trying to prepare ahead of time because they've been giving us little bits of information along the way of what may be required. And because of that, a lot of things are back ordered. You can't get your hands on everything just yet. So, but little by little. So there's some salons that are going to open and some do have no dates as of yet to when that can happen. But it's very exciting and it's very stressful for the stylists and the estheticians in this field to gather up, anywhere from 60 to 100 clients that they haven't seen in these last 12 weeks and try to fit them all in according to these new safety and regulations. So baby steps, but it is a step forward, and that's all that matters to me right now.
And you're staying positive, and as usual, Veronique's always positive too. I mean, we have a lot to deal with. As we've said many, many times, none of us has ever gone through anything like this, so it's all new. We all have been in fear for so long that it's nice to see a little bit of light at the end of the tunnel. I've been feeling it more uplifted in the past couple of weeks, just hearing that things are looking good. Although, Veronique and Audrey, you did hear that there was one more case announced just this past week in Campbellton that was recently announced. We've been doing really good, though, for a couple of weeks. There have been none.
Yeah, well, it's interesting. I know that we don't want to see any cases, of course, but I think we need to kind of wrap our heads around the fact that it's expected that we're going to see cases, that it doesn't mean that our social distancing isn't working or that everything that we're doing isn't working. It just means that we're slowing it down. And I think a little bit overall, we've kind of lost sight of the original reason why so many of these rules and regulations and recommendations were put into place. And that was to flatten the curve so that we didn't overwhelm the health system, right? Our healthcare system. And we have done in New Brunswick, particularly, a fantastic job of that, which meant that for those cases that did pop up, they were able to treat them. They were able to get the ventilators that they needed if they needed them. They were able to have, protective equipment for the staff. And as Dr. Lutchmedial will talk a little bit about what they had to do in St. John and the Heart Center, they had to get prepared for that. But I think people need to remember that we can't get discouraged when we see a case pop up, that it is working, that we are doing everything that we need to do, and that we still need to be vigilant. And, I have a really hard time wearing a mask in public. I find them very uncomfortable, but I am forcing myself to do it time that I go out now, because I know that that's the best thing that I can do to take care of mom, right? Because then I'm less likely to give somebody else something, and I'm less likely to bring it home to mom. So, I think we just need to remember that, we cases that pop, and we just need to stay, safe and take care of each other.
I like what you have to say, Veronique. You're so right on there. You were talking about being vigilant to certain things and staying strong. So, as three women that take part in our community on an ongoing basis, we're always doing something to try to bring light to certain facts of problems or highlight certain events in our community. This is Mental Health Awareness Month. And so Audrey and Veronique, it was our pleasure to help support those who are dealing with mental health. And we did, Veronique, was it more of a sexual abuse or mental health? It was all tied into one, but we did our little slogans there. Basically, I want to talk, pardon?
That one was for sexual assault awareness month.
That's right.
But it also ties into mental health, and you're very right there, Judy, because it's there's so much tied into what happens when women are abused and what they go through, that it is a mental health issue. You're very right.
It's 2 in 1, basically. So that's right. And I was watching the sad story that happened in Edmonton just this past week about the little girl, the 7-year-old girl. I don't know if you've seen that story or not, but she was in her home. Her mother had just tucked her in, kissed her goodnight, and the mother had just previously invited a young man into her home that was very troubled. He had come into her with an extreme crisis going on, and the lockdown was affecting him, etc. So unbeknownst to the poor mother, while she was trying to get her kids to bed and going to call a babysitter to come and watch them once they were tucked in, the man who was having this meltdown stabbed the child with scissors in front of the mom. And so she said how extremely important mental health support is. She was going to take him to the hospital. That's where she was planning to take him. But unfortunately, that did not happen, and her little girl lost her life. And last year, the same woman lost her husband, young husband, to suicide. So we've got to keep the focus on mental wellness and encourage people to talk about it, and for us to be listeners if they're having problems, that we are here for them. And if you know anybody, and I know so many that may need me, I want to be true when I say, if you need me, call me. It doesn't matter when. If you're going to do it, you just have to be there for them. I know you'd agree.
I definitely, Judy, I agree with that. And what I'm noticing or feeling, or that I fear, is that during this whole COVID and the isolation and the social distancing has only added to or escalated all these different kinds of scenarios, whether it's domestic abuse, mental, sexual, like being trapped or in your own space, like across the board. That would have been my biggest fear if you were to ask me about how everybody's making out, is those people suffering with those kinds of issues and not being able to find that escape or get that distance. But like you said, make that phone call, touch base with somebody and get, some advice and some help and some encouragement that you can get through this. It's so important. So I think this time around in 2020, Mental Health Month is, tenfold, means even more so, or it should be more powerful that we get the word out.
I agree to that. So are you both finding that you're feeling a little bit more kick in your step now that we're into almost the month of June? I mean, we've pretty well through May. How are you looking forward to your summer, and what are you going to be doing with your family, staycation wise? Any thoughts on that, Veronique?
For me, yeah, absolutely. I actually booked vacation time this summer through work. Typically, summers are spent volunteering at events like the Irish Festival and a variety of other things across the region. And although I will miss that, I actually am planning a staycation in New Brunswick. I'm hoping to get to Cape Enrage. I'm hoping to get to St. Andrews. And a few others. And if we're lucky enough to be able to bubble province with PEI, then I hope to get to PEI as well. So, you know what? And Dad comes home in a few weeks. We've gotten word now that, he's going to head this way, and I'm pretty excited about that. So, I'm actually making plans to relax and enjoy our gorgeous surroundings.
It goes by so fast that we have to jump right in. Audrey, you have 4 beautiful children and other family in the area. What do you see as your summer looking like?
Well, definitely, I'm hoping like Veronique, and that we do get a chance to bubble with Prince Edward Island. My oldest daughter Teresa's over there, and we haven't seen her or her significant other Tyler since Christmas. So I think they're feeling a little cooped up as well, and a little homesick. She is. So we'd love to be able to get to see them. But yeah, I've had to rethink of when I think of all the things that I normally partake in during the summer, I'm like, a lot of those are off the board. So we're going to have to definitely rethink it. I'm going to be very busy with work,
I know.
for sure, trying to play catch up there. So I don't know if I'm going to have a whole lot of downtime. I think I'm going to have to specifically take it in order to get it. And the kids have part-time jobs, and hopefully that will come back up. So that'll give them something a little to do as well. But it's going to take a little bit more work. Definitely going to be staying around our own province and checking it out. I hope to actually get on the water.
If you could hop on an airplane right now and go anywhere tonight, Audrey, where would that be?
Oh my goodness, what a loaded question. If I could jump on a plane and go somewhere, anywhere, definitely it would be tropical. But my husband was actually showing me a place the other evening on the internet, and it was a beautiful beach in Greece. So that's definitely been a bucket list for me. So that would be a place I'd love to go.
One day you will get there. Veronique, where are you getting on that plane and going tonight now?
I'm going to Hawaii. That's where I'm going. If I can hop on a plane right now, I'm going to Hawaii. I'm hoping to go to Banff at Christmas if the world stops being crazy. But if I could leave today, I would be on a plane to Hawaii. Absolutely.
That's been a dream of yours. Actually, I was supposed to be in Barcelona at this very time. My husband had booked me a trip, and my sister, as you know, lives there with her husband, Matt. So they're very disappointed, as am I. But you can't have everything turn out in life the way you want it to. So those days will come. And I know your trip to Greece will come to Audrey and Veronique and Banff. And we've always loved growing up, skiing and doing all kinds of things as you want to do next year. So it's going to happen. But in the meantime, it doesn't hurt to dream a little bit, does it?
No,
absolutely.
No, not at all.
Absolutely. Yeah,
that's
I'm doing a little bit. I'm doing a little bit more.
I think flying. Flying's going to be a little different than I think what we're used to, for sure. But I'm willing to do whatever it takes as long as the airlines are back up and running. I'm not going to lie; it's a little sad to see them struggling. They're struggling big time, and I'm hoping that they can bounce back from all of this and be able to, and for the rest of us to be able to see the world.
Yeah, it will happen. And what I want to do is just give the viewers just a little preview of the guests that we're going to have on today. I don't want you to go far at all, because we're going to welcome a very well-known and respectable interventional cardiologist by the name of Dr. Sohrab Lutchmedial, and he is with the New Brunswick Heart Center and has been there since about 2000. But we're excited to find out all about health and wellness and how he's been doing with the pandemic and what advice he has to give us and our viewers that have a chat. We are back with Have a Chat. I'm so happy to have with me, as usual, again on the set, return of Audrey and Veronique and myself, again, your host, Judy Losier. And we're so happy to have with us as our guest for the entire show, Dr. Sohrab Lutchmedial, who is an intervention cardiologist at the New Brunswick Heart Center. Welcome, Dr. Lutchmedial.
Thank you very much for having me on your show.
we're very honored that you would come on, especially during a pandemic with your hectic schedule. For our viewers who don't know anything or may have missed interviews with you that have been televised, you're such a great speaker. Would you just tell ourselves and our viewers a bit about yourself and maybe where you grew up and what brought you to New Brunswick, Doctor?
Sure. So, well, what I am is an interventional cardiologist. And what that means to people is that basically I deal with the plumbing in the heart. I take a look at blocked arteries and often try and open them up with stents and balloons. So we have a pretty busy practice here in the province. I was born and raised in Montreal, and I studied at Queen's University in Kingston, and then in McGill, and then at University of Montreal. So I spent a lot of my time, most of my life really, in Quebec. But when it came time to finding a job, one of the most attractive ones was actually here in New Brunswick in St. John. The Heart Center was a really terrific opportunity for a young practitioner. Myself and our young family, my partner Deanna, and our 2 children at the time, Zachary and Jonah, moved here from Montreal and settled down, made roots, and really kicked it off great with the group here, a really welcoming group of professionals, a very busy practice, but it was honestly an excellent place to start out. Really could get a lot of work done, but also I was able to establish my own programs, research programs and that sort of thing. So it was an opportunity that I couldn't have gotten many other places in the country. So we've been here actually since 2000.
That's beautiful. And we're so, like I said, we're so blessed to have such a person as yourself. My husband, Dr. Judy Losier, speaks very highly of you. And so he says to say hello to you.
He should. I see a lot of his patients, that's for sure.
Yes. And you get a wonderful reputation, Dr. Lutchmedial. I know our other hosts would love to ask you some questions. So I shall begin with, let's go with Audrey. What would you like to ask Dr. Lutchmedial?
Well, the first question for me is being a doctor and being amidst all of this pandemic, how are you doing yourself personally and work-wise with trying to balance all of that right here, right now?
Well, honestly, it has been a struggle. I mean, I recognize that my struggle is probably easier than many other people who have had their livelihoods uprooted, can't work, stuck at home. So honestly, I find myself, I am blessed because at the hospital, we haven't stopped. In fact, we've been working probably 110% over the last 2 months, but most of that has been in preparation for a deluge of patients, which didn't actually happen. And it is terrific that for once we were over-prepared and underutilized. I mean, most often in Canada, in the healthcare system, we tend to be underprepared and overworked. In this case, we really prepared extensively for the COVID pandemic. But the great responses by our politicians and by the medical teams that were in charge of the response, we're able to really smash that curve and keep the number of cases in this province down to a minimum. So we weren't hit by the COVID cases. What we did though is I probably spent an extra 20 to 25 hours a week just trying to be ready for it. And so, we rescheduled all of our patients. We didn't ask our elective patients to come in, but instead we were working hard to try and make sure they were well taken care of by telemedicine, etc. We completely revamped our whole physical operations so that if a COVID patient did come in, they wouldn't end up being placed next to someone who didn't have COVID, but also those patients that came down for procedures, it would be done safely. We wouldn't be exposing our staff to the virus, etc. And that took a lot of work, like physical work, actually putting up walls and barriers and having the right protective equipment. So all of that sounds like it isn't terribly sexy. It isn't terribly exciting, but it took a lot of work, and we're prepared now for whatever comes to us in the future. So it was a struggle, I think, professionally, and trying to keep the family intact. especially, and I'm remiss, I didn't mention my daughter, and she's going to kill me when she sees this.
Oh.
But of course, my youngest child, Miriam, was born in New Brunswick. She's graduating from high school this year. But as you know, graduation is really not all that exciting for all these kids this year. It's pretty terrible. So she's kind of suffering. So trying to keep her from losing her mind at the same time as getting all the work done has been a challenge. But again, I've been blessed with really great teammates, colleagues, physicians and nurses alike that have really helped us through this whole process.
Beautiful. Thank you. Veronique.
Perfect.
Yeah, well, it's what you do, and the Heart Center in St. John actually really strikes very close to home for me. Mom was there in November, and she had a quadruple bypass at that time, and then a stroke. The one thing is the amazing care that she received from your really made it that she is now just about 100%. And with no residual effects from the stroke or from the surgery. So, but let's talk a little bit about stats and men versus women, and what you see most often in your own practice, and how we make that better.
Well, so big question, which I'll try and give a little historical perspective, I guess. When I first started my practice in cardiology, most of my patients were in their 60s and many in their 50s. But 20 years later, nowadays, we're starting to see patients as young as in their early 30s. I've had a few in their 20s with bad genetic issues, but many young people having heart problems. New Brunswick is unfortunately, and all of Atlantic Canada actually, is unfortunately a bit of an epicenter of heart disease. Like, we have some of the highest rates of MI and stroke in the country. If we have, I think our rates are somewhere in the 2.5 heart attacks per 1,000 people per year. Well, that compares to somewhere like Ontario, it's 1.7, or British Columbia, even lower. We have an older population. We have unfortunately a population that smokes more, has higher problems with diabetes, issues with obesity, issues with hypertension. So it's a bit of a perfect storm in New Brunswick. So I am seeing a lot of younger patients. And what's been interesting over the last couple of years is, our whole approach has to be very different. I've become much more of a preventative care doctor because I don't want to see these 30-year-olds coming to the Heart Center. And it really is a bit of a switch. Instead of just dealing with people that are having their heart attack right now, a lot of us are focusing on how do we get adolescents and kids to have better lifestyles and habits so that they don't become the heart attacks in the future. And that has to be a big focus moving ahead.
That's a good answer. That was a good answer. Dr. Lutchmedial, it's just kind of been put out there that people are staying at home, perhaps because of the fear of going to the hospital and exposing themselves to what they think might be a COVID patient. So they're actually, I'm hearing, having heart, maybe palpitations or chest pain or stroke symptoms, and they're self-treating or they're staying home, which to me is terrifying when they should be actually going to ER and presenting with their symptoms. Can you touch on that?
So it is fascinating that we've seen that across the globe. And they started seeing that in Italy, that the number of patients with acute MIs was plummeting. And in fact, we expected the opposite because the COVID virus, in fact, can cause heart attack-like symptoms or cause heart damage. So we expected, with all the COVID infections, that our heart attack rates would go up. Everyone did. And we were all wrong across the globe. Everywhere that they looked and measured, there were fewer people coming into emergency room, fewer people being treated with angiograms and angioplasties and stents. And it was quite interesting trying to piece together why that is. So you can look at it two ways. I mean, there could be maybe fewer people are actually having heart attacks. Okay, that's an optimistic viewpoint, but there's some reasons why that might be. For instance, there are less cars on the road and less pollution in the road, and actually pollution rates correlate with heart attacks. Okay, there are less people waking up early, going to work, and being stressed out in those first few hours of the day, and rising early and heart attacks correlate with lack of sleep, fatigue, and waking up to go to work. Okay, so there's less of that. Potentially less stress through the whole day. Okay, so these are good things, right? I mean, perhaps COVID, by forcing people to stay home and change their lifestyle, might be a good thing. But then we looked a little closer, and we started noticing that, in fact, the rates of people having cardiac arrests at home and not even making it to hospital were dramatically higher. Then we started questioning people, you know, the people that did actually make it into hospital. We started questioning them. Okay, when did you have your symptoms? Like, when did this start occurring? And the usual answer for most people would be somewhere between, 3 hours up to 12 hours. They try to write it out. That would be a typical time frame. Everything shifted. And now we're having people come in. I've had this pain for 3 days, on and off. Oh, I've had this pain for a week and a half. And we realized then that, as you said, Judy, there are many people that were scared of coming into hospital. And rightly so. They were worried about catching COVID. They were worried about putting more strain on the medical system when maybe they didn't need it. And then, there's always denial. Like, if you can come up with a reason to say, this isn't a heart attack, you will come up with a reason. No one wants to have a heart attack, right? So we can come up with great reasons. And so a lot of denial kept people home. What we're now seeing is a bit of a rebound. At one point, a month ago, we had 30% less people showing up to our emergency rooms with heart problems. Now we're starting to see that pick up, and we're starting to see that rate rise to the normal, and probably now exceed normal, because people that have had symptoms for a week are now showing up, but they're showing up sick, and they're showing up with heart failure, and they're showing up with problems that we could have avoided if they had shown up early. So it's a real shame that we are these people are missing their chance for the best possible treatment in some cases. And quite honestly, I've seen people that have come in so late that we have not been able to help them at all, and people have passed. And that's an absolute tragedy that's occurring. That is what we kind of look at as a unofficial mortality of COVID, right? It's not the virus that killed someone. It was the fear of the virus, and their death will never come down as a COVID statistic, but it is.
Right.
Exactly. All right. So who would like to ask Dr. Lutchmedial the next question that's burning?
Well, I'll go ahead if you don't mind, Judy. You had mentioned, doctor, about when you first started your practice that you were seeing patients in their 60s. And you've noticed that, especially in New Brunswick and the Atlantic provinces, that it's much, much lower. Can you tell us a little bit about what their symptoms would be in a younger patient, male versus female, to the older generation? Are they different? Are they not noticing the symptoms? Or have they changed?
So, okay, you raised two very important points. One is that there is a bit of a difference between how people present when they're older and versus when they're younger. And two, male versus female. So let's start with the second. Women do present differently than men. And what we call typical angina, or typical cardiac symptoms, would be a crushing pressure here in the chest that feels like an elephant sitting on your chest. Some people use other animals like cats or dogs, but it's an animal usually sitting on their chest. Can radiate to their throat, to their shoulder, down to their arm, can cause sweating, and nausea. Those are typical symptoms. How often do people show up with typical symptoms? Not all that often. Most people are a little different, and women are especially different. So women can present with much more difficult to pin down symptoms. They can feel fatigued. They can feel just the nausea. They don't have to have chest pain. They can just have more discomfort in their belly or just in their arm. They can present with no symptoms at all. So why that is, a lot of people hypothesize are these hormonal differences, etc. And that very likely is the case. But women definitely do present differently. And that's even more troublesome when you look at younger patients. So a younger woman who's working, who has children to take care of, and typically they have multiple jobs, right? This is the way the division of the sexes is, that the women carry not only a regular job, but also the childcare for the most part. And so they're struggling to carry on all those activities. So when they get nausea and a little bit of discomfort in the belly, they will write it off as, I've just ate something, and they will ignore it. So women, unfortunately, can present later than men. Men can tend to present with more typical symptoms and can present a bit earlier. So women are a tricky population. And so when I tell people come in to the hospital early, many times they tell me, well, I never would have thought this was my heart, doc. This really didn't seem like a heart-related issue. And I don't blame them. It doesn't. The truth is, though, certain things you should always treat as serious. Okay, yes, chest pain and pressure, that is serious. But when you get sweaty and lightheaded, that's important. When you get short of breath and you can't make it across the room without gasping or having to stop, that's important. Those are the things, that when you're prevented from carrying out your usual activities and it's a sudden change from one day to the next, those are the symptoms you need to treat as
Right.
Very serious, potentially.
We're going to take a break and get you right back on our show, okay?
You bet.
Thank you. Welcome back to Have a Chat. I'm your host for this afternoon, Judy Losier, joined by my always beautiful co-hosts, Audrey Lynch and Veronique Arseneault. And we, again, are so happy to have with us from the New Brunswick Heart Center, Dr. Sohrab Lutchmedial in our presence, an interventional cardiologist. And he's been answering a lot of very important questions. And I think Veronique had the next question for the doctor.
Yeah, it's amazing information, and I really want to thank you for that. And building on all that, and of course, as I look back at family history now, and we have a history of heart disease in the family now, what is your best advice for us out there on having a healthy heart, maintaining a healthy heart, and going from here so that we don't end up with you again?
So terrific question, because prevention is the best medicine. It's also the hardest. And we all recognize that we want to live a healthier lifestyle. It's just often difficult to get there. So my advice to many of my patients is, choose realistic goals. You may not be able to lose 60 pounds in a year, but aim for 20. You may not be able to change your diet to become a vegan, but change your diet to start off by, say, getting rid of fast foods. You may not be able to exercise and run 10K, but start by walking 3K. And so when I talk to patients that have established heart disease, it's always about doing something, making goals, setting those goals, but they have to be realistic, and then setting multiple goals, because there's nothing worse than setting an unrealistic goal, not reaching it, and then you give up. And that happens a lot. So, you like to have wins. You want to have a lot of wins. And so setting small, realistic, multiple goals is one way to do it. The cardiac rehabilitation programs that David Buick and Cleo Sear started and have spread out through the whole province are fantastic. And they're really amazing avenues for patients to learn about heart disease and learn about how to exercise and do better. But the second part of your question relates to how do you prevent heart disease when you don't have it, when you're just a 30-year-old young parent and you've got a lot on the go, and you recognize that you don't want to end up like your dad who had the bypass. And there, again, it's being realistic. I think for me, avoid some things, right? Like avoid smoking. It's clearly not a good idea. We all know how many diseases smoking causes. So that's like numbers 1 and 2 on my list. Don't smoke, stop smoking. But beyond that, then honestly, it's exercise and diet. And you can't really do one without the other. I think that, you want to eat better. I've had marathon runners who come to me and they say, I'm in great shape. Why is my cholesterol high and why am I getting heart disease? I'm like, well, what's your diet like? And they tell me, I eat whatever I want because I run so much. That's not the right idea. You actually still need to eat well, even if you exercise a lot. And similarly, if you are trying to eat well, daily exercise will help you maintain a healthy weight. And that doesn't mean, becoming stick figure thin. No, you can be healthy at many different weights. Again, be realistic about where you're going. You can have a body mass index of 30 and be very healthy and very physically fit, 30 or higher. It's just a matter of eating better and doing more exercise. And again, trying to get daily exercise in is important. And you want to be a model for your kids. You want to be a model for your partner. And doing it yourself every day, I think, is important. We need to find the time. And that's, getting back to COVID, we've had a little bit more time at home to do things. How many of us have been using all that extra time to try and do a few things for ourselves? It's hard. If you have a lot of young kids at home, I get it. You're not going to find time to, go for a jog every single day. But we should be trying to maybe figure out what's really important in our lives. And is getting kids to 6 different activities after school that important? Or should you maybe cut it down to 3 activities and do an activity with them? Maybe you should be doing something physical with them and not just sending them to one class after another. So maybe COVID is I hope that it might help us reestablish a bit more of a family connection and a bit more time together. I think that would be healthier. So try and use some of that in healthy physical activities together. That's a try.
Wonderful advice for all of our viewers and for us. Dr. Lutchmedial, I'd like to hear about the Give campaign, and is there an actual member on the New Brunswick Heart Centre or in there that's part of this whole campaign?
So the foundation, the St. John Regional Foundation, and their Give campaign, and they have been working with many of our cardiologists and surgeons over the past number of years. This particular year, their Give campaign is looking at renovating a huge clinic area, which all of us utilize. Cardiology and surgery and urology and orthopedics and many, many different departments. It helps us all. So their Give campaign is actually working with basically physicians and nurses from every single specialty. But we love working with the foundation. They're fantastic. They have been able to do a lot for the Heart Center. Most recently, they helped us purchase 3 ECMO machines, and ECMO is like extracorporeal membrane oxygenation. That's basically machines that help people who cannot breathe or circulate their blood for themselves, and they helped us purchase those just recently. That's the kind of thing that the foundation does. They target the areas of need at the Heart Center, and they've been able to help us develop many of our programs over the last number of years. So, people like Ansar Hassan, myself, and JF Legare, we love working with them. They call on us often, but usually we know that it's an excellent relationship. We both gain a lot from it.
Wonderful. So happy to see this happening. Always great causes that come together in support of the heart and the heart machines that you need. Veronique, I guess it's Audrey's turn to ask a question.
Well, as I was going over information about you, doctor, and reading your bio, my question stems from a little bit that I had read there about a program or a research project that you were looking to, or have you started or launched with grade 10 students, getting the information out to them about, whether it's early intervention or prevention.
So yeah, that does loop back to one of my passions, which was, cardiac rehabilitation and intervention. And that particular project, we actually had on the go 8 years ago, up until about 3 years ago. And it was in St. Stephen, but we also spread it to a few other high schools in the region. And it was championed by some of the nurse practitioners and the nurses at the schools who approached me to say that they were alarmed at the levels of obesity and inactivity in some of the kids going through the school system. And so we decided to look at it. And we actually we did a few surveys where we not only had the kids, and they did consent to all of this. They and their parents consented to getting things like their weights and height measured so we can get an idea of their body mass index. We would look at their blood pressures and take their blood pressures and their heart rates. And then we had some of them actually go through doing some different blood tests and looking at their cholesterols and their glucoses. And it was significantly surprising how many of them had multiple cardiac risk factors, true heart risk factors, and had high blood pressure, high sugars, high cholesterols already for young people their age. So the numbers that we saw were in excess of what we had seen across North America 10 years ago. That tells me that, again, our population is still getting a little fatter, a little more unhealthy, and we really need to work at it. So what we did was we tried to work at it with exercise programs and interventions, dietary interventions for these kids, and they were all very interested and excited. I mean, they don't want to be unhealthy, but they just needed to have the structure around them to show them what they need to do, and then they took it upon themselves to continue it. It's just a matter of giving people the right tools, and these young people actually really did embrace taking on those tools and those opportunities and doing the best with them. What ended up eventually curtailing my particular research program is that, it really did require the champions in the individual schools. And when some of them had to move on to other opportunities, the program had to stop. It's something that I think I would love to try and take up again on a more provincial level, but that's, it's something that we have to go and actually take to the Department of Health and the Department of Education. And there's a few other groups in the province that hopefully we can work together towards doing this.
Mm-hmm. Thank you. Veronique?
Yeah, I guess I know that we're not too far off from the end of the show. So, what's the number one thing that you want our viewers to know? What's the best thing that you can tell them?
The best thing that I can honestly tell them is, look, we've only got one shot at this life. You want to make it a long and healthy life. It's worth taking the time to eat a little bit better and to do a little bit more exercise so that you can enjoy your life, as long as you possibly can. Look, we all love, having a hamburger. We all love, the odd dessert now and again, but everything in moderation. And if you're going to enjoy dessert, then, think about your diet the rest of the week. And all I have to say to people is, any of my patients, I just want them to embrace little changes. Make little changes every month and every year, and just keep moving forward, because you get enough of those little changes, and 2 years later, you won't recognize who you are when you've made multiple changes in your life. And I have heart patients who have already had established heart disease, who have been able to start up a completely normal lifestyle, and who've been able to take up, physical activities and go back to playing hockey and go back to playing soccer or running 10Ks. Heart disease isn't the end of the world, but it can be if you mentally let it. And what we just need to do is remember that we can make changes in our lifestyle now to prevent heart disease, and we can make changes in our lifestyle if we already have heart disease to be healthier and happier people. And we've all got it in us. So don't give up. We can always do better. That would be my message.
Well, thank you, Dr. Lutchmedial. I just wanted to commend you again and your fellow the cardiologists at the New Brunswick Heart Center for all that you've given to our province. My own mother is a recipient of Open Heart and has heart issues, and other people that I know and are close to and friends with. So we just know that our province is a lot better for having you in it. As I said, you do great work. My husband and my son, who actually went through the Heart Center, gave you great praise. He trained there, Evan, as part of his internship, and had a great experience. So we wish you much good health in the future. And thank you so much for being our guest and have a chat today, Dr. Lutchmedial.
Thanks to all of you. I appreciate the opportunity.
Have a great week.
Yes, thanks for joining us.
Thank you.
Bye.